Hello students, as today it is World Hemophilia Day, 17th April. Every year this day has been celebrated for awareness and a lot of programs for making the public aware about hemophilia and hemophilic patients. First of all, what is this hemophilia? Hemophilia is usually an inherited bleeding genetic disorder in which the blood does not clot properly. This can lead to spontaneous bleeding as well as bleeding following injuries and surgeries. Blood contains many proteins called clotting factors that can help to stop bleeding. People with hemophilia with low levels of either factor 8 or factor 9. The severity of hemophilia that a person has is determined by the amount of factor in the blood. The lower the amount of factor, the more likely is that bleeding will occur, which can lead to serious health issues and serious health problems. Now, what are the causes of this hemophilia? Hemophilia is caused by a mutation or a change in one of the genes that provide instructions for making the clotting factor proteins needed to form a blood clot. This change or mutation can prevent the clotting protein from working properly or missing altogether. These genes are located on the X chromosomes. Male have one X and one Y chromosome, that is XY. Females have two X chromosomes, that is XX. Males inherit the X chromosome from their mothers and the Y chromosome from their fathers. Female inherit one X chromosome from each parent. Here, the X chromosome contains many genes that are not present on Y chromosomes. This means that males only have one copy of most of the genes on the X chromosome, whereas females have two copies. Thus, male can have a disease like hemophilia if they inherit an infected X chromosome that has a mutation in either the factor 8 or factor 9 genes. Females also can have hemophilia, but this is a very much rarer case. In such cases, both X chromosomes are affected, or one is affected, other is missing or in inactive form. In these females, bleeding symptoms may be similar to that of males with hemophilia. A female with one affected X chromosome is a carrier of hemophilia. Sometimes a female who is a carrier can have symptoms of hemophilia. In addition, she can pass the affected X chromosome with the clotting factor gene mutation on her to children. Even though hemophilia runs in families, some families have no priority history of family members with hemophilia. Sometimes there are carrier females in the family, but no affected boys, just by chance. However, about 1/3 of the time, baby with hemophilia is the first in the family to be affected with the mutation of the gene for the clotting factor. Now, hemophilia can result in bleeding within joints that can lead to chronic joint diseases and pains. Bleeding in the head, sometimes in the brain, can cause long-term problems such as seizures and paralysis. Death also happens if bleeding is not stopped, because if it occurs in a vital organ such as brain. What are the types of hemophilia? There are several different types of hemophilia, but the following are the two most common hemophilias which I am going to say you children. Hemophilia A, commonly called as classic hemophilia. This type is caused by lack or decrease of clotting factor 8. The second type is hemophilia B, commonly called as Christmas disease. This type is caused by lack or decrease of clotting factor 9. Now, what are the signs and symptoms? The signs and symptoms are common, that is bleeding into the joints, bleeding into the skin, bleeding of mouth and gums, bleeding after having shots such as vaccinations, bleeding in head of an infant after a difficult delivery, blood in urine or stool, frequent, hard to stop, bleeding in nose. Students, the treatment is the best way to treat hemophilia is to replace the missing blood clotting factor so that blood can clot properly. This is done by infusing or administrating through a vein commercially prepared factor concentrates. People with hemophilia can learn how to perform this infusion by themselves so that they can stop bleeding episodes anytime and can prevent most bleeding episodes. One of the best choice for care is to visit a comprehensive hemophilia treatment center, that is HTC. It not only provides care to address all issues related to disorders, it also provides health education that helps people with hemophilia to stay healthy. Students, let us make a proper awareness of this genetic disorder called as hemophilia. Thank you.